All right, so the urinary system is a way for you to dispose of your waste, and that waste is going to be your urea, uric acid, and creatinine. So generally, these are nitrogenous wastes. Okay, these are nitrogenous wastes. Our body cannot handle nitrogen, so we got to dispose it through the kidney. Okay, so you have nitrogenous waste. Some of them is going to be metabolic waste. Some of them would actually also excess water, and toxins is going to be eliminated by the kidney also. Okay, so the basic structures you see macroscopically is going to be the kidney, then the connection to the kidney to the bladder where the urine is stored. That's going to be the ureter. Okay, and then after that, once the bladder is full, it's going to come out from the urethra. Okay, so that's actually the structures that we need to take a look at. Now, if you notice that the adrenal gland is the one above the kidney, remember adrenal gland, we studied that when we went through our endocrine system. Okay, so let's go and take a look at some of this kidney structures that are macroscopic. Okay, now this is going to be the kidney on the right side, the kidney on the left side. The right side is lower compared to the left side. And the reason for that is because the liver is bigger on the right side. Remember, the right lobe, the liver is bigger, so that pushes the kidney down a little bit lower. Okay. Now, the hilus, when you talk about hilus, it's actually this concave structure that you see on the medial surface of the kidney, and the ureter is attached to that. Okay, so the hilus is a concave surface, and remember, blood vessels enter and exit through the hilus, also nerves. Okay, and the kidney is surrounded by a capsule. But let's take a look what it means when it says retroperitoneal. Okay, so when you say the word retroperitoneal, it means that the kidney is not inside the peritoneal cavity. It is inside the abdominal cavity, but remember the peritoneal cavity is different. So the peritoneal cavity is made out of your visceral peritoneum, the one that lines the covering of the organ. Okay, and then after that becomes your parietal peritoneum. The space in between them is going to be called the peritoneal cavity. Okay, now if you notice that the peritoneal cavity does not have the kidney inside it. Okay, it's actually located outside the peritoneal cavity. That's the reason why the kidney is called retroperitoneal. Aside from the kidney, the vein called the inferior vena cava and the aorta, they're also retroperitoneal structures. Okay, so this is how you visualize the location of the kidney in terms of its place inside the abdominal cavity. Okay, it is retroperitoneal. Now, if you take a look at the covering of the kidney has a lot of protective fascia that covers it in order to protect it. So we have first of all, we have a lot of these fats, okay, that is outside the kidney. Those are what we call the pararenal fats. Now, the fascia is a covering from the posterior and the anterior. So we call the fascia the posterior, we call it posterior renal fascia, and the covering anteriorly to that is called the anterior renal fascia. Okay, and then inside those fascias are going to be again fats, and we call it perirenal fats. Okay, then the covering now that is enclosing the kidney, okay, that is going to be called your fibrous capsule. So notice that there's a lot of things that protects the kidney because the kidney is very soft, okay, and so it has a lot of this fascias and a lot of the fats that actually absorbs any of the shock or injury to the kidney. Remember, renal vein goes back to the inferior vena cava, but the renal artery comes from the aorta. Okay, so whatever is floating in your renal artery is actually going to be waste products that's going to be excreted out by the kidney. So if you take a look at the renal artery, okay, Because remember, the renal artery actually has your waste product. You have a lot of nitrogenous waste here floating in the plasma. Okay, and the renal artery will then divide into what we call segmental. Okay, so let me change the color to green. Okay, so the renal artery will divide into segmental artery. Okay, so those are your segmental arteries. And if you take a look at the path, I already summarized it for you. The aorta becomes the renal artery, and then becomes the segmental artery. And after the segmental artery is going to divide into interlobar, okay, interlobar artery. And after the interlobar artery, it becomes an arc, and that is going to be your arcuate, okay. So we have the interlobar artery, and then we have the arcuate artery. So they're actually creating an arc, okay, on the peripheral portion of the kidney, and then after the arcuate artery, it becomes a cortical radiate artery. So it radiates from the arc, becomes the cortical radiate artery. Okay. The reason why it's called cortical radiate is because the area that you see here outside of the kidney, okay, that is called the renal cortex. Okay. So if I put a line, so I'm going to change my color, purple. So if I put a line along the periphery, okay, I can divide the kidney into two areas. The outside portion is called the cortex. Anything in the middle portion, all of this here is called the medulla. Okay. Now in the medulla, you're going to see a lot of this pyramids. Okay. And we're going to see what's inside those pyramids. The pyramids is what we call the renal pyramids. In between the pyramids is going to be your columns. So I got another pyramid here and another pyramid here. And then in between them, they're going to be called your renal columns. Okay. Now, if you take a look at your cortex, you have the arcuate artery and the cortical radiate artery. But if you take a look between the medulla, which is going to be between the pyramids, that's going to be your interlobar artery. And then actually before it divides into interlobar, we're going to call it segmental. So I put a mnemonics to make it easy for you to memorize. S-I-A and then C. Okay. So the artery becomes smaller and smaller because it's going to become capillaries. Okay. So this is going to be a small artery called the afferent arteriole. Then it becomes a capillary called the glomerulus. And then it's going to exit again as a small arteriole called efferent arteriole. So you can say A-G-E-H. Okay. Now, once it goes through the efferent arteriole, it's going to try to reach back to the vein, go back to the inferior vena cava. So the efferent arteriole connects with the peritubular capillaries or the vasa recta, and then they will then go into the cortical radiate vein. And then after the cortical radiate vein, they become the arcuate vein and interlobar vein. Okay, and then it goes to the renal vein and back to the inferior vena cava. So that means that it starts out as arteries to become arterial, capillary, and then becomes an arterial again, and then becomes capillaries to connect with the vein called the cortical radiate vein, arcuate vein, interlobar vein, renal vein, and inferior vena cava. Okay, so those are your blood vessels that is created inside the kidney. So these are now microscopic structures. We're going to be looking at them, okay, and then associate them with the tubules called the renal tubules that you see that is located in the pyramids. Okay, so nerve supply, we call it renal plexus. Nerves also follows the arteries and the vein. And then we have the frontal section of the kidney that you see here. We identified the renal cortex. We identified the renal pyramids. Okay, and then we're going to identify these tubes that will drain whatever is actually taken out by the kidney. Okay, so let's take a look at those tubes. Okay, so if you take a look at those blood vessels right here, called the cortical radiate arteries, the blood vessel will then filter the waste products into the tubules of the kidney. So all these tubules will actually carry the microscopic drops of urine. All these renal tubules that are happening here at the renal pyramid. Now, within that tubules is going to actually drain into collecting ducts. Okay. And then from the tip of those collecting ducts, that is called the renal papillae or the papillae of the pyramid. And then from there, it's going to drain into the calyx called the minor calyx. So all this small opening is called minor calyx. And then from the minor calyx, it's going to drain into the bigger opening called the major calyx. Okay. So that's going to be called the major calyx. And then after the major calyx, it's going to drain into the renal pelvis. And then from the renal pelvis, now, if you actually take a look at the structures here, the minor calyx is going to be very visible. You don't need a microscope for that. You can visibly see it. And also the major calyx and the renal pelvis. Okay. And then from there, it connects to the structure called the ureter. The ureter will connect into the urinary bladder. Okay. So those are your renal pelvis connected by the major calyx and connected by the minor calyx. Okay. All right, so we have vasculature that we discussed. It came from the renal arteries. Okay, it then branch off to the segmental, interlobar, arcuate, and the cortical radiate artery. Okay, and then it becomes smaller vessels called the afferent arteriole. It becomes the glomerulus. At this point, the glomerulus is going to drain to the tubules. And the tubules that captures the filtrate of the glomerulus, which are your waste product, that is going to be a structure called the Bowman's capsule. So the Bowman's capsule is like a cup, okay, that will take in those microscopic drugs that was filtered out from the glomerulus. And then from the Bowman's capsule, it then goes to the tubules. Okay. And then from the tubules, you're going to have a lot of these tubules that will actually collect into a common duct called the collecting duct. And then from the collecting duct, it goes into the renal papillae. And then from the renal papillae, it goes to the minor calyx. Okay, and the minor calyx goes to the major calyx. And the major calyx goes into the renal pelvis. And the renal pelvis goes into the ureter. And then from the ureter, it's going to be stored in the bladder. And it's going to go into the opening called the urethra to the urethral orifice. Okay. So generally, these are what you call your renal tubules. Okay. So the capillary is going to actually drain, okay, the microscopic drugs urine into the Bowman's capsule, which connects to the tubules. Okay, so let's follow the glomerulus. It will go into becoming the efferent arteriole. Okay, and then from the efferent arteriole, it'll connect into the peritubular capillaries or the vasa recta. And then they will then connect into the cortical radiate vein, arcuate vein, interlobar vein, then goes into the renal vein to the inferior cava. Okay, so that's going to be the flow of your urinary system. Okay, and these are the structures that we're going to be looking at. Okay, all right, so let's now take a look at those microscopic structures that we actually looked at. Okay, so we're going to take a look at what a nephron is. So a nephron is actually the functional unit of the kidney. Okay, so the nephron actually is the one that will take in the filtrate. Okay, that is like a cup that surrounds the glomerulus. Remember, the glomerulus has your waste products, and a cup is called the renal corpuscle. Okay, but remember, the renal corpuscle is made out of the renal capsule and the glomerulus. And another name for renal capsule is called Bowman's capsule. Okay, so all the filtrate is gonna be going through the glomerulus down to the Bowman's capsule, and then it will go down to the tubules. Now your tubules is divided into different parts. Okay, so the first part of the tubule that is connected to the Bowman's capsule, that is called your proximal convoluted tubule. Remember, it explains the architecture of this tubule. It's convoluted. So sometimes we just call it the PCT. Okay. All right, so we're back in to this part that we're going to be talking about the nephron. Okay, so what are the nephrons? Okay, so the nephron is made out of the Bowman's capsule. Bowman's capsule is like a cup that drains all those microscopic drops of urine. And remember, there's a lot of them. Okay, there's a lot of them. So there's going to be thousands of this Bowman's capsule draining from the glomerulus. And then from there, the Bowman's capsule connects to the PCT, proximal convoluted tubule. And then from there, it becomes the loop of Henle, which has the descending limb and the ascending limb. And then from there, it connects into the distal convoluted tubule. Okay, so the reason why we're studying a lot of these tubules is because when you study physiology, you're going to talk about a lot of physiological concepts within those tubules, okay? Such that if you notice, okay, take note of this, the distal convoluted tubule is hugging the afferent arteriole, okay? The distal convoluted tubule is hugging the afferent arteriole because there is a physiological activity that happens between the distal convoluted tubule and the afferent arteriole. So take note of that, okay? So after the distal convoluted tubule, that connects to the collecting duct, okay? And then from the collecting duct, it goes to the papillae, renal papillae. So a lot of collecting duct connects to the renal papillae, and then it goes to the minor calyx, okay? And then goes to the major calyx. And then after that, it goes to the renal pelvis. Okay, then you have the ureter, then bladder, then you have the urethra, and then go to the urethral orifice. Okay, so these are the tubes that we're actually talking about. But remember, the Bowman's capsule, okay, and the proximal convoluted tubule, the loop of Henle, and the distal convoluted tubule. These are what we call nephron, okay? And then connects to the collecting duct. All these structures that you see here, these are microscopic, okay? You can only see it out the microscope, okay? But this is how they're configured, okay? So you have all these structures located at what we call the nephron, okay? Nephron is a functional unit of the kidney. Got thousands of this. Okay. All right. So now, when we actually talk about the collecting duct, so a lot of this nephron collects to the collecting duct. Okay. So one nephron here, another nephron here. Okay. So a lot of nephrons connect to the collecting duct. Okay. And the collecting duct is also involved in urine concentrations. Okay. So that is going to be the basis of your physiology. Okay. All right. So this is how it looks like at the cortex. We usually see the Bowman's capsule and the proximal convoluted tubule, but the loop of Henle digs deep down to the medulla. And then we have the ascending limb, and then you have the distal convoluted tubule that goes into the cortex and then goes to the collecting duct. Now, if you look at the collecting duct, it has a hole, and that's going to be your renal. Okay, renal papillae. Okay. All right. So now we talk about the nephron. Okay. So that was a nephron, which is made out of your tubules. Okay. Now let's take a look at the blood vessel. Now, if you take a look at the blood vessel, okay, you can trace it from the arterial blood vessel first. Okay. Remember, all the waste of the kidney, the nitrogenous waste, is carried by the plasma at the area of the artery. So remember, this is your cortical radiate artery. I'm sorry, arcuate artery. Okay. So this is your arcuate artery. And then after the arcuate artery becomes the cortical radiate artery. And then after the cortical radiate artery it becomes the afferent arterial, A, small a. Remember? And then from the afferent arterial becomes this capillary called the glomerulus. That is this one here, glomerulus, glomerulus capillaries. And then from the glomerulus, it actually exits out into becoming the efferent arterial. Okay, and then from the efferent arterial, it is wrapping around the tubules. So vessels, if you notice also, it actually is a little bit on violet color because it's actually going back to the vein. So the blood vessel that wraps around the tubules, okay, those are what we call your peritubular capillaries. So the blood vessel that wrap around the tubules called peritubular capillaries, but there's going to be also blood vessel that wraps around the loop of Henle like a ladder. Okay, let's take a look at the description. It's similar to a ladder that wraps around the loop of Henle. That's going to be the vasa recta. Okay, and then after the peritubular capillaries in the vasa recta, they're going to go back and connect into now the part here is going to be your vein called the cortical radiate vein. Okay, and the cortical radiate vein then connects into the arcuate vein. And then the arcuate vein goes back into what we call the, remember it goes back as a cortical radiate vein, arcuate vein, interlobar vein, and then the renal vein. Then from the renal vein becomes the inferior vena cava. Okay, so that's actually what's happening onto our blood vessels. Okay, just remember the term renal corpuscle is actually made out of the glomerular capillaries called the glomerulus, plus the glomerular capsule, which is called the Bowman's capsule. Okay, so when you hear the word renal corpuscle is made out of two structures called the glomerulus and the Bowman's capsule. Okay, now nephrons can either be located in the cortex, which is 85% of them. We call it cortical nephrons. And then some of them is going to be digging down into the medulla, and we call it juxtamedullary nephrons. So if you notice that some of them digs down into the medulla, okay, especially the leukotenli, those are the juxtamedullary nephrons. Okay. All right. So if we talk about a little bit of physiology about mechanism of urine production, this is what your physiology class is going to teach you, because there's a lot of physiology concepts here in the urinary system. So the first one is, remember, this is from the cortical-radiated artery, becomes the afferent arterial, and then it becomes the glomerulus, and then A is filtration. That's called glomerular filtration. So some of the waste can be filtered out between the glomerulus and the Bowman's capsule. Okay. So now waves are actually filtered out here and will pass through the tubule. Okay. But remember, some of the waves cannot be filtered out into that glomerulus. So they actually still goes out into the afferent arterial. And remember, these are your vessels that wrap around the tubules. They're called the peritubular capillaries in the vasa recta. Why do they wrap around the tubule still? Because remember, some of the waves are still inside these vessels, okay? The peritubular capillaries. So if somehow, okay, some of the waste is going to be excreted out through the tubule, we call it tubular secretion, okay? So that means that the filtrate, you weren't able to filter it out at the glomerulus and the Bowman's capsule. So you're going to be secreting it between the capillaries, peritubular capillaries, and the nephron. And that process is called tubular secretion. Okay, so other things that can happen is whenever you filter down to the nephron, somehow they're going to be recalled back into the capillary, such as water. Okay, and that's actually done by the antidiuretic hormone. So water is returned back to the capillary, and that is called tubular reabsorption. That'll be okay. So the three processes of the mechanism of urine production is filtration, that's happening here between the glomerulus and the Bowman's capsule, reabsorption happening at the tubules in the capillary. Okay, so that's the letter B. Reabsorption. Okay, and then we have the secretion that's happening also between the blood vessels, capillaries, and the tubule. Okay. So those are the concepts of actually the urinary system. Okay. So again, you will actually get it into the physiology class. Okay. All right. So let's take a look what it looks like inside the glomerulus. So if you notice, the glomerulus is covered by these cells called podocytes. The podocytes produce what we call filtration slits. Okay, so what does the podocytes do in terms of the pores of the blood vessel? It actually makes the slits, the opening, actually smaller. Okay, so if you take a look at this part here, this is on the blood vessel. Notice that the blood vessel has this hole called pores onto the blood vessel. So the pores are quite big, but apparently once it goes into the tubules, okay, it actually has these cells called podocytes, and those cells actually make the opening smaller. See, the opening becomes smaller. So that means that it can only allow some molecules or some chemicals that can pass through those small slits. Okay, proteins cannot pass through the slits. These are called filtration slits. Okay, because it actually minimizes the amount, the diameter of those slits, so that some of the chemicals that are big molecules cannot pass through the slits. So where will they actually pass through instead? they're going to pass through at what we call the secretion process at the tubules in the capillary. Okay? So this is what happens to your nephron. Okay, I'm sorry, it is what happened to the filtration membrane. You have the glomerulus, and the glomerulus is inside the Bowman's capsule. Okay. All right, so this is actually the description of what the filtration slit is. It minimizes the opening, so it will control big molecules pass through. That's the reason why proteins cannot pass through those slits. If proteins are directly visible on your urine, that's called proteinuria, which is abnormal. It means that your kidney's filtration system is actually damaged, okay, because it allows the proteins to go through. You don't want proteins to pass through there because proteins are held inside your plasma. Okay, so the sections of the nephron, we talk about the PCT, proximal convoluted tubule. Okay, so from the Bowman's capsule, we got the proximal convoluted tubule. Then from there, it goes to the loop of Henle. It has the descending limb. Okay, we have the thin and thick ascending limb. Okay, and then becomes your DCT, distal convoluted tubule. Okay, now let's take a look again where those structures are located at. Okay, so we have this Bowman's capsule would actually carry those microscope drops of urine. So all this will drain the microscope drops of urine. It goes to the proximal convoluted tubule, PCT, goes to the loop of Henle, and then goes to distal convoluted tubule called BCT. Okay, same as here, we got the proximal convoluted, the loop of Henle, and distal convoluted. Okay, so all of them will drain into what we call the collecting duct. Those are what we call collecting ducts. And remember, there's thousands again of these collecting ducts in just one pyramid. This is called a renal pyramid. Okay, so all the collecting ducts will end up into the renal papillae. Okay. All right, so now we have your association of the blood vessels and the nephrons. So again, you can actually see that the filtrate goes to the glomerulus. Sorry, back other way around. Goes to the glomerulus. It will actually produce what we call filtration. Then goes into the proximal convoluted tubule. Then it becomes your loop of Henle and distal convoluted tubule. Then from distal convoluted tubule, it goes into what we call the collecting duct. Okay. Then from the collecting duct, it goes down into, I'm sorry, this is the collecting duct. So these are actually still part of distal convoluted tubule, DCT. Okay, so now if you talk about blood vessels, you have the glomerulus, and before the glomerulus is the afferent arteriole, then exits out as your efferent arteriole. Okay, and then from there it will pass through what we call peritubular capillaries, tubules that goes into the peritubular capillary, which is located the convoluted tubules, and from there it also has branches going down like a stairway. Okay. Structure is called the vasa recta, and those vessels will then turn back to the vein, okay, which is going to be your, so this vein is now is actually still part of your capillaries. Okay, these are your peritubular, connected from the peritubular capillary and your vasa recta. Then once it actually goes into this venous structure that's called the cortico-radiate vein. Then cortico-radiate vein will then go into the The cortical ray vein will then go down into what we call the arcuate vein and back to the renal vein. Okay, so again, I'm stressing the microscopic structures, okay, because this anatomical microscopic structures are the one that you will be discussing when you study physiology. Okay, at least you know what that structure are. Okay, now let's go to the JG apparatus, juxtaglomerular apparatus. Remember, I told you that the distal convoluted tubule, okay, the distal convoluted tubule, which is actually also part of the ascending limb of Lupus-Henle, okay, will then hug around the afferent arteriole. So that's your afferent arteriole, because there's actually a physiological activity that's happening within between the distal convoluted tubule and the afferent arteriole. Okay, so what is that activity? So you have the macula densa located at the distal convoluted tubule. So it can also be connected from the distal convoluted tubule. We have your epithelial cells around the distal convoluted tubule. So this all your epithelial cells right here. That epithelial cells is called the macula densa. And the macula densa act as chemoreceptors. Okay, so chemoreceptors. So when actually there's a low sodium level in your blood, it's monitoring the sodium level in the blood here. It actually means that your blood pressure is low. Okay, so that is the reason why your macula densa is a sensory receptor to monitor the blood pressure in the afferent arteriole. Okay, so when the afferent arteriole blood pressure is low, they're going to actually be releasing your renin, which is going to be a hormone, by your JG cells. So the JG cells are the one located around the juxtaglomerular apparatus. So the JG cells will then release the hormone renin, and it is a vasoconstrictor. That means that, remember, when your blood pressure is low, you could actually be bleeding. So what the kidney will do is it will secrete renin through the JG cells, and renin is a vasoconstrictor. When you constrict the blood vessel, it actually will maintain normal blood pressure still because you're decreasing the volume. So the blood pressure will actually maintain that pressure, okay? And that's the reason why you have that relationship called the JG apparatus between the macula densa of the distal convoluted tubule or ascending of the Lupus-Henle that monitors the sodium content, even the carbon dioxide content in terms of the afferent arteriole, okay? So once it's noted that it's low, then it will secrete renin, which is a vasoconstrictor. Purpose of vasoconstriction is to maintain blood pressure. Okay, so we finished with all the things that we need to look at, those microscopic structures. Okay, just remember a lot of physiology in that concept, but we're not going to be tested on physiology, we're just being tested on anatomy. Okay, so this is what a ureter looks like. So the ureter is like a tube connecting the kidney down to the urinary bladder. So if you notice that the lumen is actually not circular, it looks like clover leaf pattern. Okay, so that's actually what the ureter look like. Okay, what lines the inside the ureter is the epithelium, and remember we talked about that. We call it the transitional epithelium. Okay, and then around that would be two layers of muscle, the longitudinal and the circular layer. Okay, because they can actually produce what we call movement. Okay, in order to squeeze the urine that comes from the kidney to go into the bladder. Now, when you say adventitia, that's just the outside covering of this ureter. Okay, that is called adventitia. All right, so now let's take a look at the bladder now. Okay, so we just finished with the ureter. Now let's take a look at the bladder. Now, if you take a look at the The difference of a full bladder and an empty bladder, okay? The full bladder can expand into the abdominal cavity halfway to the belly button. So that's how enlarged would that bladder be, okay? So remember, you don't want to actually have this problem always in which you retain fluid in your bladder. So if you feel that fullness, you gotta let go and urinate, okay? And if you notice that the flat bladder, meaning the empty bladder, is located in the pelvis. Okay, so if it's flat, it just stays in the area of the pelvis. When it becomes full, it extends up into the abdominal cavity. That's about from the one half to the belly button. Okay, so about half. Right. So now the walls of bladder again is made of transitional epithelium. But there's another muscle layer there that's very famous called the detrus muscle or detrosal muscle. They should be OR beside each other. The detrusor muscle, that's a muscle that squeezes the bladder so it connects it out into the urethra. Okay. So now take a look now at the difference between the male and female bladder and urethra. So if you notice that the female's urethra is so close to the bladder, about 3 to 4 centimeters, and is their distance. So the orifice is outside of that. Okay, so the external urethral orifice, they're actually close to the bladder itself. But in men, the connection outside called the external urethral orifice is far away from the bladder. Okay, so the bladder is actually far away. In this case here, actually see why. Okay, so the bladder is far away from the external opening or the external urethral orifice. So in terms of clinical differences, it is usually the female that will suffer from urinary tract infection. When you say urinary tract infection, that is the bladder infection called cystitis. So females constantly have problems about urinary tract infection because of their anatomy. The urethra is only about 3 to 4 centimeters compared to the male. That's longer. Okay. And what is actually the another hole surrounding the urethral orifice? It's actually the anal canal. Okay. And remember, organisms through the anal canal can easily move into the external urethral orifice. Okay? That's how women actually suffer from what we call uh, cystitis, or general term is urinary tract infection. Okay? But men, it's not going to be possible because opening external urethral orifice is literally about 9 to 12 inches longer. Okay? So the bladder is unlikely to have what we call your infection. Okay, so that's how you differentiate the two organ system, male and female. All right. So now we finished with the urethra, and remember, urethra now connects into the exterior portion of the body. Okay, so in men, another thing we're gonna study this also again in the male reproductive system. The urethra is divided in three parts. The prostate gland is located below the bladder. So the prostate gland that has the urethra inside, we call it the prostatic urethra. Okay. And then it's going to travel through this part here called the urogenital diaphragm. This is a muscle that holds your external genitalia. Okay, and that urethra now, since it actually goes into the muscles that is located below the anus, located below the penis, which is the male reproductive, that opening is called membranous urethra. So the membranous urethra then travels down into the penis, And remember that part in the area is called the corpus or spongosum. Those are actually the erectile bodies that are located spongosum, that is located inside the male external genitalia. So the urethra that passes through there is called the spongy urethra, or sometimes they just call it the penile urethra. Okay, so that tells you that the male urethra is actually quite far away from the orifice. Okay, so what you have right now is urinary system models. We can actually practice on identifying them based on the models that we use in class. Okay, so I'm gonna open up my pen so we can actually take notes on it. Okay, all right. So the first is macroscopic structures, structures that are visible. We're going to identify them, and the visible structures here is actually going to be your kidney. Okay, and on top of the kidney is what we call the adrenal gland. Okay, now we see the renal artery that enters into the kidney. So remember, the renal artery will divide into the different vessels that will actually become your glomerulus. Now, the renal vein is also visible, and the vein is actually the one that will take the small arterial capillary back to the vein, and it connects into the inferior vena cava. The connection of the kidney to the bladder is called the ureter, and the bladder is the one where it's stored, okay, for later on to be urinated down to the opening called the urethra. All right, so these are the structures that we're going to be looking at. Okay, so just concentrate on the kidney here because the kidney is very cut in coronal plane. So you can see that the outer portion of the kidney is actually called the renal cortex. So the inner portion of the kidney is actually the medulla. Okay, so anything below here is going to be the medulla. Okay, now we see also pyramids located at the medulla. So the medulla has the pyramid. So let me actually take off some of those labels. So these are your pyramids. So these are actually called the renal pyramids. They look like pyramid in shape. Okay, these are your renal pyramids. Okay, and then the renal pyramid connects to small openings called the minor calyx. So the minor calyx are the small openings. Then it connects down into the big opening after the minor calyx becomes the major calyx. Then the major calyx would then connect into the renal pelvis. Then from the renal pelvis connects to the ureter, and the ureter will store it in the bladder, which is not seen here. Bladder was removed in the model. The only thing you can see is the opening to the outside called the urethra. Okay, now we're gonna take a look at another picture here, which is gonna be showing you the minor calyx, the major calyx, and the renal pelvis. Okay, and then continue down as the ureter to become the bladder. And then from the bladder, okay, you could actually see a prostate gland below the bladder, so that this is male. Okay, females don't have prostate gland. And then the tube, the opening is called the urethra. All right, now we're looking now at our magnified kidneys, okay, showing you the blood vessels and the tubules, okay? So if you take a look at all these blood vessels that you see here coming out from the renal artery, okay, it actually will divide into different small vessels, okay? But let's actually concentrate on the tubules here, okay? This is your tubules, okay? And they're made out of the local thinly collected tubules, pyramids, and columns. The pyramids, okay, and between them are the columns, okay? So the tubules, which is actually the structures that you see here, those are going to be the nephron, okay? And remember, we're going to actually identify them, okay, based on to the magnified view, Okay, so we're not going to be able to see this in this model, so we're going to see it more in the magnified model view. Okay, so remember, nephron is the tubules, okay, without the collecting duct. Okay, collecting duct is separate. All right, now let's take a look at the tubes. This is called the minor calyx, minor calyx, minor calyx, then goes to the major calyx, and then goes to the renal pelvis, and then connects to the ureter. Okay, so now we're magnifying on the area of the renal pelvis. This is the renal pelvis, okay, and the major calyx connects to the renal pelvis. The minor calyx connects to the major calyx, okay. Then we have the ureter. Okay, so looking at, again, the pyramids, the area where the concave cavity is going to be called the hilus. That's where the blood vessels, renal artery and renal vein enters and exit. And then you have the ureter that exits out from that area. Okay, another picture that magnifies the hilus. The hilus is actually the concave portion of the medial side of the kidney. And then these are your minor calyx. Minor calyx connects to the major calyx, which now connects to the renal pelvis. And from renal pelvis connects down to the ureter. All right, so let's take a look at blood vessels now, okay? So again, so remember, the reason why we can actually use our book is because some books actually have different names for a certain vessel here, and I'll actually specify that, okay? So we have the renal artery. It's the same name as on our book. Divides to segmental arteries, the same name as on our book, okay? And then it actually goes between the lobes, located at the renal column, interlobal artery, the same name as on our books. The only difference is this vessel called the, this vessel arc rate is still the same as our book. We call it arc rate, but the vessels going up from the arc rate, okay, we call it cortical radiate artery, right, on our book, but some books actually call it interlobular artery. So they're the same, okay? They're the same. So cortical radiate artery is the same as interlobular, okay? Interlobular is different. So cortical radiate is the same as interlobular artery. Those are the vessels that comes out from the artery, okay? This is interlobular, or what we call cortical radiate, okay? All right, so going into the magnified view, we have the interlobar becomes the arcuate, and then this becomes your interlobular, which is cortical radiate artery. Okay, so again, another picture of the models of the kidney. The outer portion is called the cortex. The inner portion below that is actually called the medulla. Okay, then this is going to be the renal pelvis connecting to the ureter. All right, so now let's take a look at the pyramids. Okay, so the pyramids are actually those lobules. Okay, remember the nephrons are located at the pyramids. It ends here at the papillae, or renal papillae. It's actually going to be the opening into the minor calyx. Right, and then we have the minor calyx opening into the major calyx, and major calyx goes to the renal pelvis. So instead of saying hilus, hilus is actually the concave medial portion of the kidney. This tube is called the renal pelvis, which connects to the ureter, right there. Okay, another picture. Now we're looking at blood vessel now. Okay, so remember, it starts with the renal artery. Okay, and then it becomes segmental. Okay, remember S. Then it becomes between the lobes, interlobular, I, and then it becomes an arc wave. Okay, And after that, it relates to the cortex. It's called interlobular, okay, but we call it cortical radiate artery, okay, we can see. Right now, again, if you take a look at the vessels again, renal artery, and remember, renal artery follows renal vein, and all the arteries actually follows your vein also, okay, and then segmental artery. Then after segmental, we have interlobar between the lobes. The lobes are actually called the renal pyramids. Interlobar is through the columns. So the area where the interlobar passes through, those are what we call the renal columns. Then after that becomes an arcuate. Okay, and then it becomes an interlobular. Okay, so again, this is cortical radiate. Okay. All right, so now we have another main, trying to actually put on names in the area of the kidney. Okay, so we're going to take a look first at the renal cortex, outer portion. Okay, and then we have the pyramids, the papillae of the pyramids, the opening here, the tip, it's called the renal papillae of the pyramids. Okay, the area here is called the renal medulla, where the pyramids are. Then the place where the renal medulla or the pyramids are actually in between, as your renal column. Okay, then each of these are called pyramids. Okay, and then we have the pyramids connected to the minor calyx. But remember, the papillae is the one that drains to the minor calyx. The papillae is the tip of the renal pyramids. Then it goes into the minor calyx. And then from the minor calyx, it becomes the major calyx. Then from the major calyx, then it becomes your renal pelvis. Then from the renal pelvis becomes the ureter. Okay, now let's take a look at this. We're going to go and take a look at the blood vessel again, okay? Renal artery is followed by the renal vein, okay? Remember, the renal vein goes out to go to the inferior vena cava. Renal artery goes in to become small vessels. So from there, you're going to see that it actually becomes branches from the renal artery. So those branches are going to be the segmental artery. Okay, so we've got segmental arteries. And then from there, it becomes the interlobar artery. Okay, interlobar is vessels that are located in between the pyramids called the columns. These are your columns. Okay, then it becomes the arcuate. Okay, and then from the arcuate, it becomes your interlobular, okay, which is actually the same as our cortical radiate. Okay, and then remember, the vein will go back into the renal vein. So just follow the arcuate vein through the interlobar vein to the segmental vein, and then passes to the segmental vein. It becomes your renal vein. Then from the renal vein, it becomes your inferior vena cava. Okay, and we identify the columns, spaces in between are called renal column. The tip of the pyramids, that's number 13. These are your papillae. So you see a lot of the collecting ducts exiting at the papillae. Okay, and when they exit out of the papillae, they pass through the minor calyx first, then it goes to the major calyx and renal pelvis and ureter. Okay. Now this one, okay, is actually going to actually name the cortical radiate arteries as what we actually identified. Okay. Instead of actually naming it as interlobular, they use the name that we actually use in our cortical radiate. Okay, so let's follow again the renal artery. Renal artery divides to segmentals. After the segmental. Okay, let me actually see deactivated by segmental. Okay, so this is going to be your segmental artery. And then after segmental, it goes in between the pyramids. That is your interlobar artery and vein. And then it becomes an arc. That's called arcuate artery and vein. So after the arc, now it becomes what we use in our labels called the cortico-radiate artery. Okay, those are your cortico-radiate artery. And remember, nephrons are located, that is, from the area of the cortex to the medulla. Okay, those are nephrons. And this dots, red dots that you see here, which came from the cortico-radiate artery, these are called your glomerulus or glomeruli. Okay. Right. So now we have the cortex, medulla, the colons, and that's in between your pyramids, and these are your renal pyramids. And connecting on the tip of the pathway, that's going to be your minor calyx, major calyx, renal pelvis, and to the ureter. Okay. Right. Another picture. Now, we actually just followed the segmental arteries, segmental vein from the renal artery and the renal vein. And then becomes your interlobar between the lobes and becomes the arcuate. And now we're using our labels called the cortico-radiate artery. Okay, so we're now using that name that we use in our book, cortico-radiate. Okay, but remember, it can also be called interlobular. Okay, now this is actually what a kidney looks like in gross anatomy. This is actually in a cadaver. Okay, so if you take a look at the schematic diagram, it actually still has the same identification. Okay, so we have the medulla, the cortex, okay, and then we have the colons, the spaces between the medulla or medulla or renal pyramid. And then we have the minor calyx opening from the medulla papilla or renal papilla to the minor calyx, and connects to major calyx, and renal pelvis, and then goes down to the ureter. Right? So now we are actually magnifying now our nephrons. Okay. So remember, this blood vessel that you see here, that's your capillary, that's going to be your glomerulus. It's yellow. Okay, so the blood vessel that you see inside here, that is called your glomerulus. Okay, and the cup that holds the glomerulus, that is called your Bowman's capsule. And we also call it the renal capsule. Okay, and then from there it becomes a tubule that is convoluted. That is proximal convoluted tubule. Then it becomes the loop of Henle. Okay, and the loop of Henle is actually divided into a thick and thin descending, thick descending, thin descending. Then you have a thick and thin ascending. Thin ascending, and then it becomes a thick ascending. Okay, and then from there it becomes your distal convoluted tubule, or your DCT. And remember, the DCT hugs the area close to the glomerulus called the afferent arteriole. So take note of that, because that's actually a physiological concept that we're going to be talking about. Okay, again, if you take a look at this one, the Bowman's capsule. Okay, remember, this is going to be your glomerulus. And then we have the proximal convoluted, the loop of Henle, the distal convoluted. Okay, and if you note the distal convoluted also again hugs around the glomerulus or the afferent arteriole. There's going to be a very important physiology about that. Okay, which is going to be macula densa and JG cells, and JG cells secrete renin for vasoconstriction. Okay, so we're not going to actually do our physiology concept because that's actually the one that you will do when you actually take the physiology class. Okay, all right, so let's do it again. We got the Bowman's capsule covering the glomerulus. We have this blue structure called the PCT, proximal convoluted. Then we got the descending loop, ascending loop, and we have the distal convoluted. Okay, take note, distal convoluted again hugs the area, goes through the glomerulus. Okay, and this is actually what it is. So this is your afferent arteriole. The afferent arteriole can become your glomerulus, and then will exit out as your efferent arteriole. Okay, now this is the distal convoluted tubule hugging the afferent arteriole because distal convoluted have cells here called the macula densa. So those cells called the macula densa are chemoreceptors. So they detect if the blood pressure is actually low. Okay, so the blood pressure is low, the JG cells will secrete renin. Okay, and renin is a vasoconstrictor. Right, another picture got this glomerulus, Bowman's, proximal convoluted loop, and then descending a distal convoluted tubule through the collecting duct. So let's follow this collecting duct, and it'll actually end into the renal pathway. That is actually the renal pathway, and that is the one that connects into the minor calyx. Okay, so let's take a little blood vessel. Okay, so the arcuate arteries is followed by the arcuate vein. This is called the interlobular artery. Okay, again, this is also your cortical radiate artery, which then becomes an afferent arteriole, then goes inside the Bowman's capsule to become glomerulus. Is that our glomerulus? And will exit out as your efferent. Okay, exit out as your efferent. And then remember, the loop of Henle and the blood vessels that are associated with that, okay, the vasa recta, they're the one that actually wraps around the loop of Henle. Okay, now let's take a look now. Okay, another picture. Okay, so we have the arcuate, cortical radiate, afferent, and inside is the glomerulus. So this capsule that covers it is called the Bowman's capsule. Okay. So again, this one is the Bowman's capsule that covers the glomerulus. This is your proximal convoluted loop of Henle, becoming distal convoluted. Then we have the collecting duct. Okay. Another picture of the nephron. Okay, so you have the glomerulus inside. So this is Bowman's capsule. Remember, the nephron is the Bowman's capsule together with the proximal convoluted, and it becomes a loop of Henle, it becomes the distal convoluted to the collecting duct. And you have a lot of collecting ducts going into that renal pathway. Right? Magnified view of your glomerulus in the Bowman's capsule. So the Bowman's capsule, or what we call glomerular capsule, hugs around the blood vessel called the glomerulus. Okay, so this would be your afferent and then efferent. So afferent connects to the glomerulus, efferent goes out away from the glomerulus. And how do I know this is afferent? Okay, because I see my distal convoluted tubule. Remember, I said, take note, the distal convoluted tubule hugs onto the afferent arteriole. Okay. Another picture, okay, the glomerulus inside the Bowman's capsule, and then goes to the proximal convoluted tubule. But if you notice that the afferent arteriole connects to the glomerulus, and then from the glomerulus it exits out as your efferent. Okay, and this is your JG apparatus. Okay, so what is a JG apparatus? Within the walls of the distal convoluted tubule, that's your distal convoluted tubule, these cells are called the macula densa. The macula densa are chemoreceptors. They monitor the pressure inside the afferent arteriole. Okay, so the pressure goes down. The cells called the JG cells located in this area of the JG apparatus will secrete renin, produces vasoconstriction. Another picture, and remember afferent to the glomerulus. Then from the glomerulus becomes efferent. And how do I know this is afferent? Okay, because I see my distal convoluted tubule or the assembly with the loop of Henle monitoring the pressure at your afferent. Okay, so if you also notice that glomerular, uh, the glomerular capillary is covered by what we call podocytes. Remember, the podocytes are the one that will actually create smaller filtration slits. Okay, so these are your filtration slits. So it actually makes it small opening in order to get big molecules to go through. Okay, those are from the podocytes. Okay, and then the bulbous capsule. Remember, we talked about this on the tissue. Is lined by simple squamous. So this is simple squamous. So the lining around the bulbous capsule, simple squamous epithelium. But the lining of the tubules is simple cuboidal epithelium. Okay, now let's take a look at another picture. Again, we have the glomerulus inside the bulbous capsule into the proximal convoluted tubule. Okay, now I know this is not afferent because the distal convoluted tubule hugs around the afferent. It monitors the pressure on the afferent arteriole. Okay, and around this area is called the JG apparatus. All right, another picture. This is the glomerulus. Okay, so those are your glomerulus. Okay, and then so the glomerulus is covered by a capsule called the Bowman's with the proximal convoluted, is then the loop of Henle, and then distal convoluted, the collecting duct. Okay, so your loop of Henle actually has made out of your thick segment ascending, thick segment descending, thin segment ascending, and thin segment descending. Okay, because remember, there's a lot of physiology you're going to be talking about when you talk about urinary fissure. Okay. All right, so another picture. Okay, the vasa recta is the one that will wrap around the loop of Henle. Okay, it's not a good representation because the vasa recta looks like stairs, ladder. Okay, so this is the vasa recta going around the loop. Okay, so again we have the nephron. Okay, so it's actually the same identification we had. This is another picture. Okay, now you see the blood vessels now. Okay, so it is the. Okay, so like it's yellow. Okay, so we have the vessel from the renal artery at this point is called arcuate, becomes cortical radiate becomes afferent, afferent becomes glomerulus, then glomerulus exits with an efferent. Okay, now if you notice that the efferent can either go around the tubules, the convoluted tubule, so if it goes around the convoluted tubule, we call it the peritubular capillary. Or the peritubular capillary. But some vessels, instead of actually going through the tubules, convoluted tubules, they actually go around to the vasa recta like ladders. So that part is going to be your vasa recta. And then from them, they actually return back into what we call the uh, cortical rate vein, and then to the arcuate vein. Okay, going back to the renal vein to the inferior renal cable. Okay, so this one's not really very good identification for the nephrons. Okay, but you can actually see this part here that wraps around the loop. It's going to be your vasa recta. Okay, and then here again, ladder like. Now this is actually going to the convoluted tubules. So this is called your peritubular pathway.